All right, so today I'm going to be doing a newborn assessment. I'm going to come in the room, do hand hygiene, put on gloves, and I'm going to identify the baby with their MRN and date of birth and make sure this is correct baby, that it matches the mom. I'm going to ensure that the baby is warm, as this is going to be happening soon after the baby is born. And so I'll turn the radiant warmer on, and I will have the baby wrapped up in a blanket and just try to only expose the areas that I need to get to. So first I'm going to observe the posture. Everything should be pretty midline and symmetrical in the baby. The arms and legs should be flexed and sporadic, or the movement should be sporadic and coordinated. The baby's cry should be high-pitched and strong. The extremities should have a full range of motion. So I'm going to check the head, make sure it moves forward, backward, side to side. I'm going to check the arms, so make sure to check all the joints in the arms, the shoulders, and the elbows and the wrists and the fingers. Make sure they fan out appropriately. The legs should be of equal length. The knees should be even. You want to check the movement of the hips, of the knees, of the ankles, and the toes. Make sure that everything has a full range of motion. So then to test for hip dysplasia, I'm going to do the Barlow test and the Ortolani test. So you want to flex the infant's legs like this and put your first and second fingers on the outside so you can feel the greater trochanter. And you want, for Barlow, you want to move inward like this and see if you feel any cracking. And then for Ortolani, you want to move the opposite way outward like that. So you should not feel any cracking. The femoral head should not be reduced back into the hip joint when you do that. You don't want to see any reduction. And you also want to make sure that the baby does not have club feet. Okay, so moving on to vitals, I will count respirations for a full minute. We should see 30 to 60 breaths per minute, and it can be irregular, an irregular rate of breathing. It doesn't have to be regular in a newborn. I will take the temperature in the armpit, so I'll do the axillary temperature. This should be 35.6 to 37.2 degrees Celsius. If the baby does have a pulse ox on, if there's a reason for concern, it should be above 90, preferably above 95% O2. The blood pressure is not usually taken in an infant, but if we did have to take it, you would use an appropriate size cuff and you would take it in either the arm or the leg. So the normal range for an infant blood pressure is 50 to 70 diastolic and 30 to 40 systolic. So then you also want to take the apical pulse. So I would make sure my stethoscope is warm before I start this, but I would find the point of maximum impulse and listen to the apical pulse for a full minute. And this should be anywhere between 110 and 160 beats per minute. So then while I have my stethoscope out, I can go ahead and listen to heart sounds and lung sounds. Heart sounds should be a murmur. It can be normal or abnormal. The pulse, also for cardiovascular, if you want to find the pulses, the femoral pulses will be right around here, and they should be strong, and so should the brachial, and they should match the apical pulse. For respiratory, again, while we have our stethoscope, listening for that, you just want to make sure that the lung sounds are clear. And let's see. You want to make sure the baby does not have any signs of respiratory distress, such as nasal flaring, retractions, or grunting. So then after this, I'm going to go ahead and turn the baby over on its back so that I can listen on the back. Again, I would listen to the lung sounds. And while I'm back here, I can look at the spine and make sure that it is straight. And there should not be any hair at the base. That could be a sign of spina bifida. And then also when we have the baby on the back, you can make sure that the legs have symmetrical folds, or really they look like rolls on the back of the thighs. Okay, so for more measurements, the weight of the infant should be 2,500 to 4,000 grams. And when you're weighing the baby, you want to make sure that the scale is taired appropriately. So if you have a diaper on the baby, you want to make sure that you tear the scale with the diaper. And you want to make sure that you put a blanket to prevent any heat loss and keep the infant as warm as possible. For length, you're going to use a length board, measure from the top of the head, make sure they are as straight as possible, and to the bottom of the feet. A normal length for the baby is 48 to 52 centimeters. And then another measurement you can take is the chest circumference, which should be taken from at the nipple line, and then at the even with the base of the scapula on the back, and this should be 30 to 35 centimeters. So skin, just some observations. The color should match the ethnicity. You may see acrocyanosis, which is totally normal. Another normal finding is that the skin's dry and flaky. You might see milia, erythematoxicum, and then lanugo. So for the lanugo, it's normal to have it, and it's also normal for a full-term baby to have patches of bald spots where the lanugo is kind of going away. You might see cracks in the skin on the abdomen, the hands and feet. As far as birthmarks, you might see pigmented birthmarks such as Mongolian spots on babies of ethnicity or of darker skin ethnic backgrounds. And then you also might see cafe au lait spots, so that you can check the turgor of the skin as well to make sure the baby is not dehydrated. So it should be, when you pinch it slightly, it should return back quickly. And then lastly, for the skin, you also want to look for jaundice. Make sure they're not presenting any signs of jaundice, like they're yellow in their skin or in their eyes. Okay, so moving on to the full head to toe. The head, for the circumference of the head, you want to measure at the largest point, and you want to make sure that it's even with the eyebrows. So a normal finding for the head measurement is 30 to 37 centimeters. Again, the head should move freely from side to side. You want to check for caput succedaneum or cephalohematoma. Both of those would be abnormal findings, but not extremely concerning. The fontanelles, so your anterior fontanelle is going to be right on the top of the head. It's going to be diamond shaped. You want to make sure that it's soft and firm, and it's totally normal to feel a pulsation. And then on the back of the head, the posterior fontanelle is triangle shaped. And again, same thing, should be flat, soft, and firm, and it's okay to feel a pulsation. The suture lines, you should be able to feel those. It's okay if they are overlapping on the baby's head. As far as marks on the face, you might see forceps marks if it was a forceps delivery, or vascular birthmarks. And you want to make sure that the baby's face movements are symmetrical as far as their crying and other things. So ears, you want to make sure that the ears are fully formed, that the cartilage is present. As far as where they are set on the baby's head, you want to make sure that the top of the pinna is in line with the inner canthus of the eye. And as far as hearing goes, you can just make sure that the baby's responding to loud noises. The eyes, they may look crossed, and you might see signs of pseudostrabismus, which is totally normal. The eyes should be even with each other, and you want to look for an epicanthal fold. You should not see that. That would be an abnormal finding. As far as the color of the iris should be deep blue. The sclera should be a bluish white color. You don't want to see any discharge from the eye, and then you also want to use the ophthalmoscope to check for the pupillary response to light. You should see constriction when the light passes over. The nose should be midline in the baby's face, and you want to check for patency of both nostrils. So a good way to do this is to make sure that the baby's mouth is closed first. So put a pacifier in, and then just occlude one nostril and make sure the baby is still breathing and still perfusing oxygen. Make sure they don't turn blue when you do this. And then you also want to check the other nostril. As far as the mouth, you should not see any teeth. You can go ahead and stick your finger in the baby's mouth and feel around, feel the top of the palate, feel for teeth, feel that the tongue is freely moving. The color of the mouth should be red or pink and moist, and it's okay to see Epstein pearls. While your finger is in the mouth, you can check for the sucking and the gag reflex as well. The neck, you want to make sure that the neck is not webbed at all. And while you're here, you can check and make sure that the clavicle is not fractured, which you probably would have seen with the range of motion test that we did before. But you also want to check for palpate for masses, make sure that the trachea is midline, and you want to separate the neck folds just to look at skin and make sure that there's nothing going on there that shouldn't be. The chest, so the chest should be circular and symmetric. There should be 2 nipples, and they should also be symmetric. Breast enlargement or engorgement is normal, and you can also measure the areola in the nipple. The nipple itself should be about 5 millimeters. So for the hands, you just want to make sure that there's no webbing, there's no polydactyly or syndactyly. You should have 5 fingers that aren't connected to each other. You want to check for a single palmar crease. You should not see that. That would be an abnormal finding. So the abdomen, you can go ahead and listen to bowel sounds. You want to make sure you listen in all 4 quadrants. It should be active bowel sounds. The shape of the tummy should be relatively round and soft. Then for the umbilical cord, it should be white or yellowish in color, and there should be 3 vessels. There should be no bleeding for the umbilicus either. You can also do a deeper palpation of the stomach and feel for the liver. It's hard to feel for, but you can feel it in some babies. So for GI, you want to assess for any signs and symptoms of bleeding. You want to make sure that the blood glucose is between 40 and 80, and monitor the stool output for that meconium within the first 24 hours of life. For GU, you want to watch the I&O, the characteristics of urine. It should be, normal, yellow, clear. It's also okay to see a little bit of blood or brick dust on the diaper. This is a pseudo menstruation that happens sometime after birth when the mother's hormones are no longer present. For the genitals, so for a female baby, the labia may be swollen. This is totally normal. And then the labia majora should cover the labia minora. And then again, like I said, the white or blood-tinged mucus is normal here. For a male, their scrotum may be swollen, and also it should appear to have the rugae. You can palpate testes, and if the baby is truly full term at 40 weeks, they should be descended by them. You want to check for cryptorchidism, hydrocele, hypospadias, and epispadias. So just seeing all those characteristics of the testicles and the penis as well. So you want to assess boys and girls. You want to assess for the patency of the anus to make sure that it's possible for the baby to have a bowel movement. And then you can also stimulate the anal reflex by doing 1 swipe on the side of the baby's butt cheek, I would say. So you also want to assess for any lumps in the inguinal area in here. You should not find any. So for muscular and the joints of the baby, we've already done range of motion and the hips, but you just want to also check that the knees are equal in height. Neurological, the baby should be alert, they should be crying, they should have good muscle tone, they should not be tremoring or jittery or having any seizures or anything like that. And as far as the reflexes go, so the Moro reflex is the startle reflex. So basically you can hold the baby and kind of act like you're going to drop them a little bit, and what you should see is hands and feet kind of flare out together symmetrically like that. They kind of turn into little C shapes. The palmar grasp reflex, you can test by putting your finger inside the baby's palm, and they should wrap their fingers around yours. The plantar grasp, the same thing. So when you put your finger behind the baby's toes, they should grasp down with their toes. The Babinski reflex, you want to start at the heel and do a kind of J-shaped swipe across the sole of the foot, and then when you do this, the toes should fan out. The tonic neck reflex, so for this one, if you turn the neck to one side, this arm should flex, and then this arm should should extend like this, and same thing for the other side. You turn the baby's head like this arm should flex, and that arm should extend. The stepping reflex, so if you hold a baby up above a surface like this, they should kind of put their foot down and pretend to step. We've already checked the sucking reflex, but the rooting reflex, you can swipe the baby's cheek, and they should start to look around for a nipple or something to suck on. And then as far as a safety assessment, you want to make sure that the baby's ID band is present. If there are like tracking devices, you want to make sure that the mom and baby are both using those. You want to assess that they are using the ABCs for sleep, so alone, back, and in the crib, or the radiant warmer. And then you can go over some car seat safety when the time comes. So I am now all done with my assessment. I'm going to cover the baby back up, see if they need a diaper change maybe, give them back to mom, make sure they are in a proper place. So yeah, I'm going to take off my gloves, wash my hands, And that's the end of my assessment.